Hello guys, let's explore more important additional aspects of the epistaxis and its management. Coming to one-liners, the most common site of the epistaxis in the children and young, obviously it's little's area. Can we all just recap which arteries are included in the little's area? Anterior ethmoid, sphenopalatine, greater palatine and superior labial. No posterior ethmoid, very important. Main artery of the epistaxis is sphenopalatine artery, which is the most common cause of the anterior and posterior epistaxis, and it is ligated at the sphenopalatine foramen, which is present 1 cm behind the posterior end of the middle turbinate. Coming to the Woodruff's plexus, which is the venous plexus situated inferior to the posterior end of the inferior turbinate, and it is a site of the posterior epistaxis in the adults. Most common cause of epistaxis in children is trauma. Coming to adults or elderly, most common cause of epistaxis is idiopathic, and if there is recurrent epistaxis in young male, rule out angiofibroma. Coming to management of the epistaxis, for the large volume bleeds, we need to get the IV access and get the blood sample for the hematocrit and blood grouping. Also, find out the history of any drug usage and underlying conditions. When you have a nosebleed, your first instinct is to tilt your head back, but you should immediately correct this. First, stay calm and sit on a chair and lean your body and head slightly forward. Use your thumb and index finger and firmly pinch the soft part of your nose. This applies the pressure to the bleeding point and take the visible breaths through your mouth. Do this for at least 10 to 15 minutes. This is Hippocratic method. It is also known as Trotter's method. By doing Hippocratic method or Trotter's method, control the bleed and examine for the site of the bleed and cauterize with the help of the silver nitrate or bipolar cautery. In the image, you can see the silver nitrate stick is used to cauterize the site of the bleeding. If the bleeding continues, nasal packing with the sponge or gauze has to be done. This is the Merosal sponge used in the nasal packing. Anterior nasal packing is done first. If the bleeding continues, posterior plus anterior nasal packing is done. Posterior followed by anterior. If still the bleeding continues, then ligation of the arteries is done. This is the image of the anterior nasal packing. This is the image of the posterior nasal packing with Foley's catheter. If bleeding continues, ligation of arteries is done, in which sphenopalatine artery, which is the artery of the epistaxis, is ligated, followed by maxillary artery, by Caldwell-Luke approach. This is the image of the Caldwell-Luke approach where incision is given in the sublabial region, or by endoscopic transantral approach. If bleeding still continues, external carotid artery is ligated followed by anterior ethmoidal artery by Lynch-Howarth incision. This image shows the Lynch-Howarth incision. Let's revise the order of the ligation of the arteries. First, sphenopalatine artery, which is the branch of the maxillary artery, which is the branch of the external carotid artery.